Nursing homes have been around for hundreds of years, providing care to seniors and individuals with disabilities who need round-the-clock care. During the COVID-19 pandemic, they were the epicenter of outbreaks across the globe. How can we prevent such tragedy from happening again? And how can we improve America's nursing homes? Since the mid-1960s, nursing homes have been a solid fixture in America's healthcare system. Back then, they offered seniors and individuals with disabilities a dedicated setting to live, as well as receive basic care and meals. In recent decades, they've evolved to offer more medical services, as many of us are living longer, often with more complex conditions. And for millions, it offers more than a place to live out the remainder of your days.
A modern skilled nursing facility is really two different types of care in one. First, it's a rehab hospital. It's a place that people go to after they leave a hospital to get better. And so they come in for usually pretty intense physical rehabilitation so that they can get well enough to go home. And a typical stay is maybe 14 to 28 days. And what you would see would be a first-class rehabilitation center. In addition to that, we continue to take care of people at the ends of their lives, but in a much more sophisticated way that was back in the 60s and 70s. So it's really two different types of care in one facility.
Despite their evolution and improvements in care, even in the past decade, nursing homes faced a multitude of challenges prior to the COVID-19 pandemic.
Workforce, by far, is our biggest challenge. The ability to recruit and retain individuals who will care for our seniors is an ongoing issue.
We constantly struggle to find nurses, nurses' aides, and other support staff. But if they're not available and there's not enough to fill the positions and to meet the needs, there just isn't enough.
Nursing homes have experienced high staff turnover, especially among nursing staff, making it difficult to deliver consistent, high-quality care.
I've seen the regulatory world just explode, where the staff can no longer enjoy interacting with the residents to just make that resident feel loved. They are inundated with paperwork and assessments.
Caregivers can often find less stressful jobs in other settings with better pay and benefits. And nursing homes struggle to become a more attractive employer because the government primarily pays for residents' care. Most residents rely on Medicaid, the government insurance program for low-income individuals. Yet Medicaid only pays nursing homes 70 to 80% of the actual cost it takes to provide 24/7 care.
Most nursing homes barely break even. This has horrible impacts on the residents. It makes it very difficult for the providers to staff the way they want to provide the type of care that they want to, and it's all because of the chronic underfunding in these states that just don't pay enough for Medicaid.
Many nursing homes are 40, 50 years old. It's really hard to afford rehab projects to modernize or the latest tech for patient care, or even for the residents. The funding is really backwards because it incentivizes providers to have 2, maybe even 3 or more residents to a room just to be able to generate enough revenue to stay afloat. It was really a recipe for disaster when COVID hit.
There is growing concern at this hour over a possible outbreak of a mystery virus.
The CDC is sending a team here to Washington State to help investigate a potential outbreak among the high-risk population at this nursing home.
It's going to get worse and worse and worse.
As communities across the country try to stop the spread of the coronavirus, nursing homes repeatedly, particularly vulnerable. Data from the Kaiser Family Foundation finds more than 10,000 people have died from coronavirus in nursing homes.
Long-term care facilities were the epicenter of the pandemic. By the end of 2020, more than 120,000 individuals in long-term care had died due to the virus, accounting for nearly 40% of COVID deaths in the U.S. Meanwhile, the government restricted residents to their rooms and banned visitors as well as group activities.
This virus has really been devastating for individuals who are in nursing homes. They have multiple chronic diseases, and many of them, over half of them, are over the age of 80. That is the group that does really poorly with influenza or other viruses. Not a surprise that when you see a virus like this, that you'd see a disproportionate number of deaths and hospitalizations coming from this sector.
Early on in the pandemic, experts were still learning about the novel coronavirus. A crucial point was that it was commonly spread through people who didn't show any symptoms. This made it difficult to detect and prevent further spread.
The guidance from public health officials was changing every day. And even though we were screening staff, coming into the building, taking temperatures, washing hands, doing everything that they advised, we would still get cases. It was just this invisible enemy, and every level of government was behind on advising us on how to stop it.
Researchers from academic institutions and the federal government consistently found that nursing home outbreaks were driven by high spread in the surrounding community.
We would watch these rates so closely. It was crazy because it would just amp up not only our anxiety, but all of the things that we were doing to try to defend those residents. But at some point in some facilities, we just couldn't stop it.
Staff upped their game with use of masks, gowns, gloves, and hand washing. But again, the care that one has to provide is very intimate. You're helping someone get dressed and bathed and up close and helping them get in and out of bed. So you're very close to individuals. And we know when you're indoor and you're breathing really hard, even then with some of the masks and everything else, the virus is going to spread.
Worst of all, public health officials failed to recognize the serious threat the virus posed to long-term care residents and lend support to providers, leaving facilities scrambling for things like testing, personal protective equipment, and additional staff.
At first, you could only get a test if you had symptoms and were hospitalized. Then we began to get tests, but it would take 5-10 days, maybe even longer to get the results back. We searched and searched for PPE. When we could not even get medical gowns, we made some using trash bags. While many of our staff members went above and beyond the call of duty, they are such great heroes. Many others quit because we couldn't guarantee their safety. And we were already stretched thin because residents needed more one-on-one care to try to stop the virus from spreading.
We begged the government for personal protective equipment and for testing, and for months it was denied. Residents weren't made a priority. Instead, everything went to hospitals. While hospitals are important, that was a huge mistake. We could have saved lives if the residents of our facilities had been made a priority. Instead, the government spent all of its time just blaming us. With no PPE and with no testing, we were unable to know who had COVID and who didn't. We were unable to keep people from getting COVID. And thousands, maybe tens of thousands of people died as a result.
When nursing homes finally received some aid months into the pandemic, it was not enough to stem the tide as cases among the general population continued to soar across the country.
We've been on our own for a lot of the resources we needed to fight this virus. And every healthcare provider and business was competing for these same resources.
I think the big challenge was that public health was all predicated on a symptom-based approach. And we could not pivot that mindset to the fact that people were spreading this who were asymptomatic. And then you superimpose on that not having appropriate PPE in the facilities and testing, then you've got a recipe for disaster. And that's what we saw.
Good day, everyone. We're coming on the air to bring you a major development of the battle against the COVID-19 pandemic. A key FDA advisory committee has just voted to recommend emergency use authorization for the Pfizer vaccine.
A CDC panel says healthcare workers and nursing home residents should get the coronavirus vaccine first.
There is some really good news. New cases of coronavirus in nursing homes across the country fell nearly 90% in 8 weeks.
The vaccine didn't just work, it worked amazingly well. And case counts have now dropped to virtually zero, and really demonstrates that when our residents and our staffs are made a priority, very good things can occur.
Prioritizing nursing home residents is at the heart of a bold new plan from the profession called the Care for Our Seniors Act. Industry leaders are calling for substantial reforms to nursing homes in order to address systemic challenges and prevent another tragedy like the COVID-19 pandemic. First, the Care for Our Seniors Act seeks to enhance the quality of care delivered by focusing on the roles of clinicians and better preparing for viral outbreaks.
If we don't learn from this pandemic, then we're doomed to replicate the same problems. We know that having 24-hour and registered nurses in a facility really help improve outcomes, and we saw that with COVID. We need an infection preventionist in our building, and we need it tailored to the size of the building and the people you're taking care of. And then I think we clearly learned that we can't rely on a stockpile in PPE, which is giving out to hospitals and everyone else. So we need these reforms.
To address workforce challenges, the industry is advocating for a multi-phased approach to attract and retain more individuals to develop a career in long-term care.
We need our federal and state policymakers, as well as our academic institutions, to help us build up the next generation of caregivers. We can support our caregivers directly with financial assistance programs like loan forgiveness, tax credits, affordable housing, and childcare. And we can incentivize higher learning institutions to recruit and train more caregivers for long-term care through subsidies and funding.
Additionally, the plan suggests it's time to revisit how the government monitors and mostly penalizes nursing homes for their practices.
It just doesn't make sense to impose this very punitive system on providers that are doing a good job. So it's really about doing what needs to be done for the resident, not about catching people making minor mistakes and then fining them, which is what the current system does. It's time now to develop a collaborative process.
Lastly, the Care for Our Seniors Act calls for a review of how to modernize nursing homes and offer more private rooms to residents.
These older nursing homes need to get with the times, and residents deserve increased privacy and dignity. At the same time, more private rooms would help support infection control and prevent something like COVID from happening again.
While these reforms would be costly, they are long overdue, and nursing homes need the help of policymakers who hold the purse strings to make these lofty goals a reality.
We're going to have to make a commitment to the elderly and to the people that live in our facilities that they are a true priority. And by making them a true priority, we will pay the cost through Medicaid to take care of them. We won't underfund it as we are doing right now. For that to happen, we need the policymakers both in DC and in the state capitals to step up and provide the care that these people so justly deserve.
And there's not a moment to waste. With a growing elderly population brought on by the baby boomer generation, the federal government estimates that nearly 27 million people will need long-term care by 2050. While many argue that individuals should receive more of this care at home, experts agree that nursing homes will remain vital to individuals who have more complex medical conditions and require 24/7 clinical care and support. So let's make nursing homes the best they can be.
Over my 40-year career now, I've gotten way more from my residents and patients than I've given, I believe. We need to invest in this group. We need to help them live the best rest of their lives. To not do so would be a failure for us as a society.
The older people in our society have given so much to the country and to us and to their families. They built the country into what it is right now. They've made remarkable sacrifices, fighting in multiple wars for us, and most or all of them have made sacrifices on a personal basis to take care of us. And now it's our turn to take care of them. This fight is worth fighting for.